What is the difference between a rheumatologist and an orthopedist? Rheumatologists and orthopedists are both medical specialists, who focus on different aspects of musculoskeletal health. But they have distinct areas of expertise and roles in patient care. Here's a comparison of the two specialties. Rheumatologist. Rheumatologists are medical doctors who specialize in diagnosing and treating autoimmune and inflammatory diseases that affect the joints, muscles, and other connective tissues in the body. They primarily manage conditions like rheumatoid arthritis, systemic lupus erythematosus, psoriatic arthritis, ankylosing spondylitis, and other autoimmune or immune-mediated disorders. Rheumatologists focus on conditions that involve chronic inflammation, pain, and systemic effects, often affecting multiple organ systems in addition to the musculoskeletal system. They utilize various diagnostic methods, including blood tests, imaging studies, and clinical assessments, to identify and manage these complex conditions. Treatment approaches may include disease-modifying medications, biologic therapies, pain management strategies, and patient education. Orthopedist, orthopedic surgeon. Orthopedists are medical doctors who specialize in the diagnosis, treatment, and prevention of a wide range of musculoskeletal conditions, including injuries and disorders of the bones, joints, muscles, ligaments, tendons, and related structures. They treat conditions ranging from fractures, joint injuries, and sports-related injuries, to degenerative joint diseases, spine disorders, and orthopedic trauma. Orthopedists are trained to provide both surgical and non-surgical treatments, depending on the nature and severity of the condition. They perform surgeries such as joint replacements, arthroscopic procedures, spinal surgeries, and various orthopedic procedures to restore function and alleviate pain. Orthopedists often collaborate with other healthcare professionals, such as physical therapists and pain management specialists, to provide comprehensive care for their patients. In summary, while both rheumatologists and orthopedists specialize in musculoskeletal health, they focus on different aspects of it. Rheumatologists deal with autoimmune and inflammatory conditions affecting joints and connective tissues, whereas orthopedists manage a broader spectrum of musculoskeletal issues, ranging from fractures and injuries to degenerative diseases and surgical interventions. Depending on the specific symptoms and conditions, a patient may be referred to either a rheumatologist or an orthopedist for appropriate evaluation and treatment. What does an orthopedist do? Orthopedists are trained to address a wide range of orthopedic issues, both surgical and non-surgical, in patients of all ages, from infants to the elderly. Here are some of the key responsibilities and areas of expertise of an orthopedist. 1. Diagnosis. Orthopedists are skilled at diagnosing various musculoskeletal conditions and injuries. They use a combination of patient history, physical examinations, imaging tests, such as X-rays, MRI scans, and CT scans, and other diagnostic tools to determine the root cause of a patient's pain or mobility issues. 2. Treatment. Orthopedists develop and implement treatment plans tailored to each patient's condition. Depending on the severity of the condition, treatment may involve non-surgical approaches, such as physical therapy, medications, bracing, and injections. In cases where surgery is necessary, orthopedists can perform surgical procedures to repair or reconstruct damaged or injured structures. 3. Surgery. Orthopedic surgeons are trained to perform a variety of surgical procedures to address musculoskeletal issues. These surgeries can range from simple procedures such as casting broken bones to complex surgeries, like joint replacements, spinal surgeries, and corrective procedures for deformities. 4. Injury management. Orthopedists often work with athletes and individuals who have suffered sports-related injuries, fractures, and trauma. They play a key role in the management and rehabilitation of these injuries, helping patients regain optimal function and mobility. 5. Joint replacement. Orthopedic surgeons are known for their expertise in performing joint replacement surgeries, such as hip and knee replacements. These procedures are often recommended for patients with severe joint pain and dysfunction caused by conditions like osteoarthritis. 6. Spine care. Orthopedists specializing in spinal care, orthopedic spine surgeons, focus on diagnosing and treating conditions affecting the spine, including herniated discs, spinal stenosis, and deformities like scoliosis. 7. Pediatric orthopedics. Some orthopedists specialize in treating musculoskeletal conditions and injuries in children and adolescents. This may include addressing issues like developmental abnormalities, fractures, and growth plate injuries. 8. Rehabilitation. Orthopedists work closely with physical therapists and other rehabilitation specialists to ensure patients recover effectively after surgery or injury. They may provide guidance on exercises and activities to improve strength, flexibility, and mobility. 9. Preventive care. Orthopedists also focus on preventive care, providing guidance on how to maintain musculoskeletal health and prevent injuries. This could include advising on proper ergonomics, safe exercise techniques, and lifestyle changes to reduce the risk of musculoskeletal problems. Overall, orthopedists play a crucial role in helping patients manage musculoskeletal conditions, alleviate pain, improve mobility, and enhance their overall quality of life. What are the orthopedic subspecialties? Orthopedic surgery is a diverse field with several subspecialties, each focusing on specific aspects of musculoskeletal care. These subspecialties allow orthopedic surgeons to develop expertise in particular areas and provide specialized care to patients with specific conditions. Some of the main orthopedic subspecialties include: 1. Sports medicine. Orthopedic surgeons specializing in sports medicine focus on the treatment and prevention of injuries related to physical activity. They work with athletes and active individuals to manage and treat sports-related injuries, such as ligament tears, muscle strains, and stress fractures. 2. Joint replacement. Surgeons in the subspecialty specialize in performing joint replacement surgeries, often focusing on major joints like the hips, knees, and shoulders. They address conditions like osteoarthritis and perform procedures to replace damaged or degenerated joints with artificial implants. 3. Spine surgery. Orthopedic spine surgeons concentrate on diagnosing and treating conditions affecting the spine. This includes addressing herniated discs, spinal deformities, scoliosis and kyphosis, spinal stenosis, and other spinal disorders. 4. Hand and upper extremity surgery. Surgeons in the subspecialty focus on conditions and injuries affecting the hands, wrists, elbows, and shoulders. They treat issues like carpal tunnel syndrome, fractures, nerve compression, and tendon injuries. 5. Foot and ankle surgery. This subspecialty involves the diagnosis and treatment of disorders affecting the feet and ankles, including fractures, deformities, ligament injuries, and conditions like plantar fasciitis. 6. Pediatric orthopedics. Pediatric orthopedic surgeons specialize in treating musculoskeletal conditions in children and adolescents. They address developmental abnormalities, growth plate injuries, congenital deformities, and other pediatric-specific orthopedic issues. 7. Orthopedic trauma. Surgeons in this subspecialty focus on the treatment of complex fractures and injuries resulting from accidents and trauma. They often work in emergency settings and handle injuries that require immediate surgical intervention. 8. Orthopedic oncology. Orthopedic oncologists specialize in the diagnosis and treatment of bone and soft tissue tumors, both benign and malignant. They work closely with other specialists to develop comprehensive treatment plans for patients with musculoskeletal tumors. 9. Orthopedic hand surgery. Hand surgeons have specialized training in treating conditions and injuries specific to the hand and upper extremities. They focus on restoring function, mobility, and comfort in the hands. 10. Orthopedic trauma. Trauma surgeons within the orthopedic field specialize in treating complex fractures and injuries resulting from accidents and traumatic events. They are skilled in stabilizing and repairing severe musculoskeletal injuries. 11. Musculoskeletal oncology. Musculoskeletal oncologists are experts in diagnosing and treating bone and soft tissue tumors, whether benign or malignant. Their work involves a multidisciplinary approach, often collaborating with oncologists, radiologists, and pathologists. 12. Orthopedic rehabilitation. While not a surgical subspecialty, orthopedic rehabilitation specialists play a crucial role in helping patients recover after orthopedic surgeries and injuries. They focus on physical therapy, exercise, and other techniques to improve strength, mobility, and function. These are just a few examples of the orthopedic subspecialties. Orthopedic surgeons may choose to specialize in one of these areas after completing their general orthopedic training, allowing them to provide more specialized care to patients with specific musculoskeletal conditions. What type of medical training do orthopedists undergo? Orthopedists undergo extensive medical training to become skilled in diagnosing, treating, and managing a wide range of musculoskeletal conditions and injuries. The training path to becoming an orthopedic surgeon involves several stages. 1. Undergraduate education. The journey begins with a bachelor's degree in a science-related field or a pre-medical program. While there's no strict requirement for a specific undergraduate major, aspiring orthopedists typically choose a program that fulfills the prerequisites for medical school, which typically include courses in biology, chemistry, physics, and mathematics. 2. Medical school, MD or DO. After completing their undergraduate degree, individuals interested in becoming orthopedic surgeons attend medical school. Medical school education usually lasts for 4 years and is focused on providing a comprehensive understanding of medical sciences, clinical skills, and patient care. Students learn about various medical specialties during this time. 3. Residency training. Following medical school, aspiring orthopedists enter a residency program. Orthopedic surgery residencies typically last 5 years, during which residents receive specialized training in orthopedic surgery. The first year or two of residency often include rotations in various medical specialties to provide a broad foundation before focusing specifically on orthopedics. Residents gain hands-on experience in diagnosing and treating orthopedic conditions, as well as in performing surgeries under the guidance of experienced attending surgeons. 4. Fellowship, optional. Some orthopedic surgeons choose to pursue additional training through fellowships to gain expertise in a specific subspecialty. Fellowships are usually 1 to 2 years in length and provide in-depth training in areas such as sports medicine, joint replacement, spine surgery, hand surgery, and more. While fellowships are optional, they can enhance a surgeon's skills and knowledge in a specific area. 5. Licensing and certification. After completing residency and/or fellowship training, orthopedic surgeons must obtain a medical license in the state where they plan to practice. Additionally, they have the option to become board certified by passing the American Board of Orthopedic Surgery (ABOS) examination. Board certification is not mandatory but is highly regarded and demonstrates a surgeon's expertise and commitment to the field. 6. Continuing medical education. Throughout their careers, orthopedic surgeons are required to engage in ongoing continuing medical education (CME) to stay up to date with the latest advancements in their field. This helps them maintain their skills, expand their knowledge, and provide the best possible care to their patients. The training process for becoming an orthopedic surgeon is rigorous and demanding, but it equips surgeons with the knowledge, skills, and expertise needed to diagnose and treat a wide range of musculoskeletal conditions, perform surgeries, and provide comprehensive care to their patients.